We will be presenting a modified flanged scleral fixation technique using a small 2.4 mm corneal incision and a standard cartridge. We'll start with our patient, which is a 40-year-old woman who has an ocular history of coloboma of the iris and lens with loss of zonules. And in the past few months, she has noticed a deterioration in her vision in both eyes, and development of cataract was noted. We initially offered the patient a combined procedure of cataract extraction and artificial iris implantation. However, she declined and was interested in cataract extraction only. And so a cataract procedure was planned with IOL fixation using the 4-flange technique, first described by Canabrava, but modified to be used through a small 2.4 mm incision and a standard cartridge. We begin the case by threading a 6/0 Prolene suture into the two leading loop haptics of an aqueous IOL, which is loaded into the provided cartridge. The two ends are then inserted through the injector. And securely positioned. The IOL is then folded into the cartridge. Two marks are made 2 mm from the limbus and 2 mm apart at the 3 and 9 o'clock positions. And then a 30 gauge needle is bent to 70 degrees. And the suture is inserted into the anterior chamber and positioned. The needle is then inserted at the lower 9 o'clock mark diagonally to create a long scleral tunnel. And the handshake technique is used to insert the suture into the lumen of the needle and then pulled out. Then the second suture is inserted and fixated using the same technique, this time at the upper 9 o'clock mark, again using a long scleral tunnel to avoid migration of the flange back into the eye. After securing the two leading haptics, the IOL is then safely implanted into the AC using the cartridge and through the 2.4 mm incision. A third needle is then used to secure the third suture, which is inserted through the haptic. And again, using the handshake technique, the suture is pulled out. And finally, the final haptic is also fixated using the same technique. Notice that the conjunctiva was slightly shifted when the needle was inserted to allow better coverage of the flange later. After the IOL is centered, we use low temperature cautery to create flanges, which are then covered by conjunctiva and also tucked slightly into the sclera. Remaining OVD is removed. The IOL is centered, stable, and the case is concluded. Thank you very much.